Well, many of you continue to reach out with questions about the coronavirus and the latest booster shot. And of course, we all have so many questions. So Dr. Mallika Marshall is joining us, as she always does, to answer those questions. So we want to begin with John, who writes, "My son is over 30 and overweight. He has had the first 2 COVID shots and 1 booster. Should he get the second booster or the new booster?"
Yeah, that's a great question. He absolutely should get this updated, what we're calling a bivalent booster, which provides immunity against both Omicron as well as the original coronavirus. Now, this new bivalent booster has replaced the old booster, and so it's recommended for basically anyone ages 5 and up who's completed their primary vaccine series and is at least 2 months out from their last shot.
Right. So if you had that booster last, November or December, this is the new one.
Exactly.
Okay. William asks, "I'll be 74 in November, and I have controlled type 2 diabetes. When should I get my COVID and flu vaccines?"
Today. You should go out and get both of them right away. You can get them on the same day. And we don't want people to delay because, as we've been talking about, we do expect a surge in COVID cases sometime this fall. We know that there's some other variants out there that are rearing their heads in other parts of the world. And it really takes 2 to 3 weeks to actually build up immunity. We also are starting to see a few flu cases around, so it's really important to get vaccinated against both COVID and the flu before we head into winter.
And you make a good point, too. You want to have that immunity before we get to wintertime, right?
Exactly.
Cynthia in Rockport asks, "Do rapid home antigen tests pick up new variants?"
Yeah, they do. So the rapid home antigen tests are still quite accurate, but they may give you a false negative result if you test too early in the infection. So if you think that you might have COVID symptoms or you think that you've been exposed and you're testing and it comes back negative, you really should continue to test for up to 5 days after exposure or after the onset of symptoms. And if you need a more accurate test sooner, you can go out and get a PCR test, go to a testing site or go to a local pharmacy. And if the rapid test or the PCR test is positive, you have COVID, because false positives are exceptionally rare.
It's true. Anecdotally, I've heard people say that. I felt terrible, and I kept getting a negative, and then it was positive.
Exactly.
Right.
It happens.
Tanya says, "I am petite, active, and healthy 62-year-old woman who's recovering from COVID. I am experiencing a little lack of taste and smell. Here's this old problem," and she asks, "Any advice?"
Yeah, so the good news is the vast majority of people who do have loss of taste and smell or distortions in their taste or smell really do regain them within a month of having COVID. But there are some people out there where it can last for months or possibly even years. So there are doctors that are doing sort of smell training where they have you smell different scents to sort of relearn it. And then there's an olfactory implant that doctors are working on that have sensors that can help connect the odor to the brain.
So interesting. Yeah, because, not having your sense of taste and smell takes a lot of enjoyment out of life.
It does.
Right?
It does.
All right, Dr. Mallika Marshall, thank you so much. And of course, Dr. Mallika answers our questions to the best of her ability, but always consult your doctor before making any decisions about your health. And here is how you get in touch with her. Email drmallika@cbs.com. On Facebook, you can Facebook message her, Dr. Mallika Marshall, or her Twitter handle is @Mallika Marshall.